Hi, this is Nancy, one of the care queens from the Hospice Care Plan. I've got a great question from a caregiver caring for a patient with a long time dwelling catheter. She asks, how do I clean the catheter bag? Well, I'm going to talk you through this and then I'm going to show you how to do it here at the setup I have. Firstly, what's really important is that you only disconnect the catheter from the catheter bag if you are changing to a leg bag during the day. If there is no switch from a bag to a leg bag, always leave the system closed until the catheter itself is changed. And this is usually done monthly or when there is a clog. A new sterile bag will then be attached. If you're changing daily from a larger bag with a longer tubing from the nighttime to a leg bag for daytime use, then this is how you clean each receptacle bag. And this goes for a patient with either a urinary catheter or a supra-pubic catheter. Rinsing a catheter bag with white vinegar is a common home practice to help reduce odor and bacterial buildup. It's safe, simple guideline you can follow. It's really helpful to do this right next to the toilet, have a table ready, or if you're lucky, you have a nice countertop to do it. What you'll need is white distilled vinegar and a clean water, a clean container, or a pitcher with a spout. Some gloves if you want them, and a pouring container with a spout. The basic steps is that you want to mix your cleaning solution first and have it ready. So I've mixed this up already, and it's a vinegar solution. 1 part of the white vinegar with 3 parts of water. For example, 1 cup of vinegar, 3 cups of water. If you're going to do this daily, you might as well mix up a full gallon. Filling the pouring container with warm water, take that, you're going to take that next to the toilet. Next, move to the patient with a clean bag, which would be a cleaned leg bag in the morning or a cleaned big bag at night. You're going to disconnect the tubing from the catheter, attach the bag that's clean and ready to use. It's extra clean if you can wipe that tubing connector with an alcohol swab before you stick it into the catheter. It takes some dexterity to be able to hold both tubings and manipulate the insertion. So practice before you actually get to your real patient. So you're going to empty the bag, of course. You're going to take it to the toilet, drain off the urine. Then as all the urine is drained from the catheter bag into the toilet, you're going to rinse that bag. First of all, you're going to rinse it with warm water, not hot. Flush out all the residual. Then you're going to pour your vinegar solution in and you're going to fill the bag and mush it around, of course, and you're going to leave it in for 20 minutes or so if you can. Just set it aside. I've got a bin right here that I do, and you're going to leave it there for 20 to 30 minutes. That's going to reduce the bacteria. Then you're going to rinse it out and you're going to put clean water in and rinse it again. Then air dry that bag. Hang it up on a hook somewhere in a closet with a towel under it, and then let it dry. You're going to do this every single day if you're using the same bag regularly. You're going to replace the catheter bag as recommended by your provider, which is 1 to 2 weeks for leg bags or monthly for a night bag. Don't use bleach. It's too harsh. It will hurt the plastic. Okay? That's what we're going to do. Now here's a quick video so you can see the process in action. Thanks so much.